Hello, Dr. Flammers. Thank you for the opportunity to present to you. For today's topic, I will talk about panic disorder. I will talk about what symptoms are typically displayed in assessing the diagnosis. I will talk about possible treatments for alleviating this disorder. And lastly, I will talk about how this disorder has affected me personally. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, the symptoms of panic disorder can include unexpected fear, sudden increase in heart rate, chest pain, shortness of breath, tinnitus, tingling in limbs, dizziness, chills, and fear of losing control. And these symptoms have to occur for at least a 1-month period. On any given day, any one person can experience any of these symptoms. But what makes the appearance of panic disorder comes into play is that many, if not all, of these symptoms occur together out of the blue. And when this happens, the individual is extremely scared, especially if it is the first time. Once a person experiences a panic attack, the dread of experiencing another one is so high that it can precipitate another attack. Like most mental disorders, the etiology of panic disorder incorporates biological, psychological, social, and sociocultural influences. Biology contributes about 1/3, with emphasis on the amygdala, the portion of the brain responsible for creating and storing emotional memories, which, when activated, causes alarm and anxiety. Psychologically, people who experience the effects of panic disorder tend to have a hypersensitivity to bodily sensations, which causes them to be hypervigilant when changes occur, which in turn heightens the physical symptoms, completing the cycle of a panic attack. Socially, people with panic disorder reportedly had stress-related issues in childhood like separation anxiety, bullying, physical abuse, sexual abuse, or a death in the family. And socioculturally, marginalized fractions of society who struggle with issues like discrimination and sexual identity are inclined to have panic disorder. Anti-anxiety medications can decrease the occurrence of a panic attack, and beta blockers can reduce symptoms like heart palpitations and dizziness. Because these medications are highly addictive, and individuals with panic disorder sometimes resort to alcohol and drugs to self-medicate, this option would only be favorable to individuals with no history of substance abuse. In addition, medication alone is not effective. However, cognitive behavioral therapy, CBT, has garnered success through education, identification, correction, and encouragement. Practitioners of CBT teach sufferers about the disorder and how to cope with the symptoms. They also identify devastating thoughts and correctly explain their irrationality. Finally, they encourage individuals experiencing panic disorder to just sit with the physical symptoms. Forms of CBT used to treat panic disorder are panic control therapy, PCT, which entails altering one's cognitions, retraining one's breathing patterns, and exposing oneself to physical prompts accompanying panic attacks, and dialectical behavior therapy, DBT, which encompasses teaching behavioral and scoping skills to a group, along with weekly homework, motivating and helping individuals to utilize the specific skills learned in group sessions, allowing clients to call a group leader at times of great stress, and team consultation, where therapists are motivated and counseled by head therapists with the hopes of better assisting their clients. On a personal level, when my cousin told me that her 21-year-old son was taking an anti-anxiety medication and seeing a therapist, I assumed that the pressure of being at Harvard University was becoming too overwhelming. She also mentioned that he avoided coming home for holidays and that he did not call as much as he did when he first attended university. He was always an anxious person. As a baby, he only went to people with whom he was very familiar. He cried if his mother was away for too long. He became hysterical after every piano recital in church. He panicked before every test, although he was a straight-A student, and he worried about getting into a good college. However, when he confided in me that he was gay and that he did not know how to tell his religious parents, I finally understood that his symptoms were associated with panic disorder. I persuaded him to have that conversation with his parents and that he might be surprised at their reaction. As expected, they told him that not only had they always suspected, but that they would always love and accept him for who he is. A month later, he called and informed me that his therapist had discontinued his medication. I chose this disorder because I've seen firsthand how accurate the diagnosis and assessment are. But more importantly, I am convinced that the treatments affiliated with CBT can provide long-term benefits. Thank you.